Good afternoon and welcome to the Carnegie Council Lunchtime Webinar Series. Like many of you, we're working remotely these days, so we're using this time to reach out to our senior fellows, friends, and constituents to talk about the important issues in ethics in public life that are at the heart of the Council's work. So thank you all for joining us. Today's topic is top of mind for all of us following the pandemic. The title of our hour-long conversation will be Health Data, Privacy, and Surveillance. How will the lockdowns end? Now, I can't promise you we'll answer this question within the 1 hour we have together, but I can promise you a deeper understanding of the values and interests that are at stake, as well as a clearer picture of the trade-offs that inevitably are coming our way. Our guests today are two experts in bioethics and public health. Effy Vayena is Professor of Bioethics at the Swiss Federal Institute of Technology in Zurich, and Jeff Kahn is Director of the Berman Institute of Bioethics at Johns Hopkins University. Both Effy and Jeff have considerable experience working at the intersection of ethics and public policy, and doing so in real time. Both have worked at the global level, the national level, and the community level in connecting scientific knowledge to rapidly emerging governance challenges. We've asked Effy and Jeff to update us on their recent efforts addressing issues in contact tracing and the potential for immunity certifications. And we've also asked them to reflect on how these tools are being approached differently in different countries. Before turning to our speakers, just a word about our format. We've asked each speaker to talk for about 10 minutes. After that, we'll have a dialogue between them for about 10 minutes. And the back half of the program will be interactive, so please use your chat function to pose questions as we go. Our moderator, Alex Woodson, will read the questions on your behalf. So with that introduction, I'll turn things over to Effy, who's coming to us from Zurich.
Hello, thank you, Joel, for the invitation. It's a pleasure to be with you virtually today. So I will, in my 10 minutes, I'll just share some thoughts about how we came to be thinking about those topics and where we are, at least from the way we look at those from that side of the Atlantic. And I'll structure these thoughts around 3 points. The first one is about the timing of this pandemic. COVID-19 actually found us in the digital era. If we think of our life before we all had to do all these things and talk about COVID all day long, our lives and all aspects of them had something to do with data or apps. So we are in a situation where the digital is really part of anything we do. And it's only natural that we would think COVID or the response to this pandemic could also have something to do with digital. In some ways, it's like we have a digital hammer, everything looks like a nail, including COVID. And we see this actually in the way all of us are thinking about the digital tools and how governments are thinking about those. Also, something that's interesting to remind everybody here is that it is not the first time we're thinking about digital tools in the context of outbreaks. Recent outbreaks like Ebola in Africa, the last two ones, Zika, at the same time or recently as well. During those outbreaks and epidemics, we used data, big data, and digital tools. It's just that I think because of the scale of those epidemics being what it was, the conversation was not as active. But these tools have been useful in those cases. And in some smaller circles, we did talk about issues of privacy, data governance in cases of emergencies. Unfortunately, although we talked about those issues, we didn't, in fact, prepare enough to be ready to deploy our frameworks or to have the thinking done before COVID hit us. So we have some examples where these technologies have been useful, and it's only natural to think about them. Another thing that's important and we all have experienced, is that this time the scale of the pandemic is very different from other times, at least in recent times. And together with that came this incredible response that we've seen from states. The measures that have been taken, drastic measures that really affected life as we know it, social life, economic life, changes that we see and effects that will probably last beyond the time of the pandemic. So states and communities have found themselves in the situation where at the same time, while trying to control the pandemic, also want to get us out of where we are. And that means the measures that have been taken in order to control the virus. So the situation is put to people this way: how can we get out? What measures can we take while controlling the virus, and not being in the situation where we need again to take these kinds of measures? And that's a difficult exercise and a difficult question, a difficult problem to solve. Now, the governments here in Europe and around the world, they are contemplating a variety of measures. And these measures have been used previously in public health emergencies. Some of them are newer, but it's the kinds of like wearing masks or shielding vulnerable populations, testing people, identifying the infected people, and then going to look at with whom they've been in contact, the sort of classic contact tracing activities. And they need to do all of these things this time at a scale that they haven't done before. And I think this is where the new difficulty is coming up. So my second point is that scale is really the question. It's one thing even to determine what is the right constellation of measures that you want to take in order to continue controlling the pandemic, and at the same time returning to some, let's say, normal or new normal at the scale that these measures are required today. Now, when we're looking at the measures, I'm thinking of them like old wine in new bottles, new fancy smart bottles, because, and that's where the contact tracing thing comes in. Contact tracing is a very old and classic method in public health. There is nothing fancy about it, even in the context of COVID. But what we are being told today is, in order to, given the way that this virus is transmitted, given the global nature of the disease, given how we live today close to each other, connecting with each other when we move around, we need to do contact tracing in a new way, in a fancy, smart way. And this is where those contact tracing apps or the digital contact tracing conversation has come in. And so our digital hammer and our digital thinking found a very concrete application in this case. In short, the projects that have been put on the table are actually not digital contact tracing per se. It's the step before. So what the apps want to do is to help the contact tracing process by identifying people through those means in order to then follow up with proper contact tracing. An example is, whereas we're all using our phones can connect or and record other phones with which we are in some proximity, and there's going to be a risk score that determines those. But the typical one is that two phones, let's say, being close to each other for 15 minutes in a distance of less than 6 feet. That could put, if one person is infected and the COVID is positive, then the contact, the person who's been in that proximity is potentially exposed and may be at risk. So that's the part that the app is going to take care of. And then you have to move into the follow-up, which is, what is this person who's been notified that is exposed going to do? Somebody has to tell them what to do. They might have to, have to go and test. They might have to quarantine, seek care, control for symptoms, etc. So what the app is supposed to be doing, or that sort of system, is to help ultimately the process of contact tracing. And the benefit that is proposed is that we can do that quickly at scale and overcoming the difficulties if we had to do that, manually, or let's say we all have to remember with whom we sat on the train. Anyway, we don't know those people. And this has been a very appealing proposition to a lot of, again, desperate governments who are looking at how to get us out of where we are and without having any good solution in their hands. So so it's the digital hammer. It's the fact that we have a kind of, good system, good method that maybe it's going to work here, and we need to put it in a fancy system because that will help us with scale. And finally, I think it's a very shiny proposition because it is, it seems to be promising things that the manual or the analog world could not give us. And here's where the problems begin, I would say. The first problem is obviously the one about privacy, in the sense that to use these things effectively, we would have to collect the data. Now, the good news is that there have been a number of proposals about those apps. Some use location data, so they know where you are and who else is there. Other projects use this proximity method, which means they only know how far from each other you are. So not who you are and where you are, but how far from each other you are. Now that seems to be a more privacy preserving option. And so it gets, at least here in Europe, it has gotten quite a lot of traction precisely because it promises to be more privacy preserving. And let's assume that privacy is preserved while this is happening, when the two phones connect with each other, because they don't connect with the numbers or with the names, but they connect with IDs that are being generated constantly, so you wouldn't know who the person is. Eventually, however, if we want the digital proximity tracing to do something, we want it to lead to some proper contact tracing, which means that downstream, and at some point, we would have to identify this person, so this person can get care, can be told what to do in terms of testing or quarantine, etc. So one of the things I'm missing in some of the presentations of the contact tracing shiny promise is the sequence of events. Yes, privacy preserving upstream, but what's happening downstream? And how do we connect these pieces along the way to when we tell people this is safe and secure, and data are used anonymously? Well, somewhere downstream you are going to be identifying. That's the whole purpose of the exercise. The second, I think, difficulty that I'm seeing with these kind of apps is that none of them has been really tested or validated. Of course, it's early days and maybe these things will happen, or this is a call out there for people to do it. They are systems that, from the engineering perspective, they look very attractive, they're clever, they are very promising, but they have to fulfill a certain purpose, and we don't know how they really work. We don't even know the risk scores, for example, how close, for how long, what exactly it means given the circumstances, what if both people wear masks, or if they're in open air or in closed rooms. All of those things will determine the risk of the exposed person. So we don't know this. We don't know how many people we need to have using those in order to be effective, et cetera, et cetera. And in some sense, for me, this is a huge social experiment that we're all going to be either invited or forced to take part with many, many unknowns. And that is one of my worries. Again, I want to say that I still think the digital will play a role, but I'm sort of, raising the worries rather than the promises. There's lots of people who talk about how shiny and promising this is. There's going to be a big question around the voluntariness of that and what voluntariness is going to mean here. Is it voluntary to download the app? And if you voluntarily download it, you then voluntarily using it, or you can forget your phone at home. If you voluntarily use it, download it and use it, and then you're notified, what happens then? What are your obligations then? Are you obliged to to contact health authorities? Are you obliged to, comply with quarantine protocols? The sequence of those events, again, is a bit unclear. At least, again, in the cases and the countries that I'm looking at, there is little clarity, lots of questions, but little clarity. Another issue that I'm seeing, and I really have no idea how this is going to play out. If you look at mortality from COVID, but also if you look at how badly people are hit in terms of financial consequences, unemployment, etc., what we're seeing is that those who are worst hit are people in lower socioeconomic quantiles. Now, couple that with what we know about a lot of data analytics and technologies that seem to are biased and have a bunch of other problems. How can we guarantee that these kinds of technologies are not going to either exacerbate or scale the existing inequalities that we have? Are we going to equally benefit from those, or some people who are going to be those who are well off and typically get to benefit more often from what's happening with technology are going to follow the same, we're going to follow the same path? What happens to those questions? And then the last perhaps worry that I have when we're introducing those technologies in a form of an experiment, but presented to us as like a wonderful solution, is what are their lasting effects going to be? In a case of an emergency right now, we don't have anything else. We're throwing everything we have at the problem, including our digital half-cooked ideas. How are we going to guarantee that there is an expiration date for those systems? Especially when they're presented to us as the tools with which we transition and the tools with which we create the new normal. They're not presented to us as, okay, you're going to have to stay home for 2 weeks. No, we're told we're going to use these tools in order to be able to move around and create your new normality. So these are some of the worries that I have, and I keep raising in these conversations where I participate. They're very difficult, no easy answers, but I think unless we have some clarity or some response to those, I have a hard time believing that the technologies will be successful as in the ways we hope them to succeed. So I'll stop here. Thank you.
Effy, thank you. That was terrific. You've given us a lot to think about. Let's just pivot over to Jeff now, and we'll pick up some of these themes when we come back to the conversation. Thank you.
Great. Hi, Joel. Hi, Effy, and thank you for including me. So if Effy's points about new technology applied to things we've been trying to do for a long time is sort of the general theme around contact tracing, immunity certification is even more prospective, I would say, and in the future. So if you think about what the parallel would be, digital contact tracing at least is trying to apply technology to contact tracing. What's the parallel for immunity certification? And the closest thing we have is proof that people have been vaccinated to show that they are immune from infectious disease. But we have something to give them to make them immune rather than the way that we're going about this in the COVID-19 outbreak. And so one thing to say before I sort of launch into the specifics here is all of this is in the context of trying to figure out how we get back to something closer to normal. And it's very much in real time. We're thinking about everything that we possibly can, and it will be a combination of the things we're talking about today and many others that will help make those decisions and how to make the decisions about reopening. So to talk about immunity certification, I've organized my thoughts in a sort of first with the sort of science and medicine, even though my doctoral training is in philosophy and I focus on ethics and public health policy. As Joel was saying, I have an undergraduate degree in molecular biology. So it's a long time ago, it's out of date, but I can pretend on the science. And among the things my colleagues who actually do know the science are talking about is before we talk about certification of immunity, we have to understand whether there is immunity. And so one prior question that needs to be resolved, and it's really a science and medicine question, is whether those who have been infected by this virus and recover have immunity from reinfection? It's obviously a basic and fundamental question that needs to be resolved. If the answer to that is yes, there's still a sort of an underlying basic question about whether everyone who's been infected has immunity. So there may be infections that are so subclinical, asymptomatic, that they don't provide sufficient antibodies to protect, but we don't know, of course. Then if there is immunity provided by recovery from infection, for how long does that last? That may be a function of both the way this virus works with our immunology, but also it may be a function of whether this virus is mutating, is changing over time. So that's why we need to get vaccinated for flu every season, and we don't get immunity once we've been infected from year to year because the virus changes. The last sort of basic scientific medical question is, even if you have immunity, and we know the answers to the questions that I've asked so far, and the answer is yes, you get immunity, and yes, we know that it works for some period of time. Can you, even though you're immune, infect other people? If you're exposed, could you bring it back into your home, bring it to the school where you're teaching, to the place where you're working, which is, of course, a critical bit of information. So that's one set of questions, none of which have been answered. The second set of questions is whether we can test for that immunity, if it exists. So among the things that have been part of the scramble is to, first of all, create a diagnostic test to assess titer, that is the level of immunity of antibodies in a person's blood that might provide immunity, and do that in a way that is reliable. In public health, that's called positive predictive value, which is a combination of false positive rate and false negative rate. So you don't want people to test that they are immune when they're not, and likewise, you don't want people to test not immune when they are. So we need tests that work, and that has yet to be created. Partly because we don't know whether there is immunity provided. But let's assume those things all play out in a way that, yes, people get immunity from once they're infected and recover, and second, that we can test for it in a way that is reliable. So then we get into the implications, which I think is probably more of the kind of conversation we want to have today. And understanding this is all incredibly prospective, just in the way that Effy's remarks were, sort of try to think ahead about how certificates of immunity would be used. So one question we would need to answer is, what would they permit people to do? So I think, are mostly thinking about this, at least in the way the popular media has portrayed it, is these would be kind of get out of our house free cards, right? We don't have to stay in quarantine and socially distance anymore if we have some kind of certificate of immunity. But we also have to think about the other side of that, which is, what would they require? So if you have immunity and other people do not, we need people to do things that allow our communities and our society and our economy to reopen. And if not everybody is immune, we want those who are immune to be doing the things that allow that first. So that's actually a kind of different flip. It's not all about liberty. It's also about responsibility. You might have different responsibilities if you're immune than if you were not. Then we have to ask, what would the social consequences of this sort of permit be? So clearly it's a way of thinking about the fitness of some people versus the fitness of others. And when we start to talk that way, it starts to feel very potentially stigmatizing and labeling in ways that have had, of course, a horrible history in the world over time, in terms of some people being singled out because they were less fit than others, without putting too fine a point on it. Yesterday was Yom HaShoah, Holocaust Remembrance Day. So it's very reminiscent of the idea that we will label certain people as having a level of fitness that is greater than others, and somehow therefore more deserving than others. And that, of course, we have to somehow work against. So while there may be fewer restrictions for some who have this sort of level of immunity, we have to figure out how to help use that in a positive way for those who are not yet immune. And realize all of the conversations we're talking about are very premature, but even as they become less premature, there still be very, very small proportions of the population who will have been exposed and recovered, at least in the United States, and I think, well, really everywhere in the world. It's a tiny fraction of the population of any of the countries that are thinking about this. So, okay, all of those things would need to be addressed, resolved, prepared for. We would then need to think about who, sort of where would this kind of certification be issued? How would we be able to ensure that the thing you're carrying around is valid? So here in the United States, our teenagers aren't permitted to drink until they turn 21, drink alcohol. And so many of them are in university environments before they are legal age to drink, and there's a flourishing market for false, fake identification cards, driver's licenses that have a different birth date on them than their actual birth date, that allow people to show up in bars or liquor stores and buy alcohol. So one imagines if these turn out to be, useful ways to allow you to go out and do things you wouldn't otherwise be able to do, that there will be likewise flourishing market. How would we ensure that that wasn't the case? Because we don't want people who are not immune to an infectious disease to be out and about doing things just because they would rather go to a concert or a restaurant or back to work because they need to earn money and use illicit ways in order to do that. So that's a kind of an important policy and logistic aspect. Another thing that loops back to the, what does immunity mean is how often would you need to have your certification renewed? It's possible that your immunity would fade over time, and depending on how long the virus is circulating around the globe and in our populations, one imagines that you might not be immune forever. So how frequently would that need to be updated, and how would that process work? So might it have an expiration associated with it, and how would we check that? Lastly, but not leastly, and then I'll sort of wrap this in a nice bow if I can, I think we have to ask what proportion of the population would need to have become immune for this to be an important part of how we think about reopening. So if it's a tiny proportion of the population and they're not at all, the people in one sector of the economy are not all being exposed and therefore immune, such that we can reopen some of the critical parts of society and industry, it will be much more scattered about. So there'll be some people at universities and some people who teach elementary school and some people who work manufacturing automobiles, but it won't be enough people in any of those things to really reopen. So how do we think about what parts of the population, how much of the population would need to be immune for this to actually matter, not just for their liberty, because that is of course part of it, but for it to affect how we think about reopening society. This is far ahead in other parts of the globe than it is in the United States. A lot of talk about doing something like certification of immunity in places like Italy, where there has been a large part of the population exposed in certain regions of the country, the northern parts of Italy. Germany as well is talking this way. And so one of the things I think will be important is, much like Effy was talking about with contact tracing, we will learn from experiments effectively that are happening in societies that may not be our own, and hopefully learn from them and benefit from them. So let me just close by saying that this notion of immunity and certification of it will be just one part of the many kinds of information and sources of information that will be important and required and necessarily brought to bear on any of the decisions about how and when and how much to reopen our societies. So with that, I'll stop.
Thank you, Jeff. That was really helpful, and it tied in nicely with what Effy was talking about, and I'm glad to see you both thinking into the future. But as you were saying, things are happening very quickly. Just one thing I wanted to pick up as a theme that cut across both of your sets of comments is the question, the way Effy phrased it, is invited or forced. Because I think implied in both contact tracing and the idea of certifying immunity, there seems to be an ambiguity in here. At some degree, it will be voluntary, but that in some circumstances may be required. And I wonder if each of you could say just a little bit more about that. What I'm thinking about is like very practical applications. So for example, when your students return to school in the fall, right? Well, this, this is, I think there are now, vaccines that are required in certain school districts for students to return. Or I'm also thinking another application might be access to public transportation. Are we imagining that we might have to either have a an app that says we're participating in this system and we're abiding by it, or some kind of certification? So I wonder if I go to Effy first and then to Jeff, just on this invited versus forced and where you see this theme going.
That's a great question, and I think we still haven't seen how this is. Well, we maybe have a glimpse of how this is playing out. I actually was talking to somebody in South Korea the other day, and what I heard there, and it's not about going back to school or taking public transportation. It's about travel. If you come into the country, you could have two options. One is to self-quarantine for 2 weeks. Or quarantine someplace, maybe not necessarily self-quarantine, maybe in a facility. The other would be that you are agreeing to download the app and, through that we have control of your whereabouts and your contacts. So you can be given an analog option and a digital option. And maybe at the moment, we're not giving a serological option because the science is not advanced enough and it's just a discussion. But we're seeing models of that form of, I don't know what you want to call that, voluntary versus forced. You've given two options to choose from. So I'm suspecting we'll see variations or combinations of those things. But at the same time, I think in some countries, probably forcing this would be really difficult, given the cultures, legal frameworks that even in the cases of emergencies, they cannot give so much license for enforcement. And I'm speaking particularly for contact tracing. So, for example, many European countries that are discussing the digital contact tracing applications, they claim that this would be only an opt-in, sort of voluntary basis. And my worry a little bit is, let's say that countries are keen to roll this out, just also in order to test the waters on a voluntary basis. The measures are not successful, things are not working out, the disease continues to spread. What's going to be next? And whether, then we can move on to maybe proposing these solutions in ways that we're forced to accept them. And what my main worry is there is, if these solutions remain half-cooked as they are right now, in my opinion, and as we heard from Jeff, but also what I say in contact tracing, I wonder how we could ever justify forcing them upon people, given what we know at this point about their efficacy in solving our problem.
Want me to jump in? Sure. So I think it's important to say contact tracing is not voluntary, right? That's a public health measure that we use for tracking down infectious disease. What we're talking about is whether the information that we might have on our mobile phones, for instance, to aid contact tracing should be voluntarily shared. Right? Those, I think, are kind of important differences. And so that's, we're trying to figure out ways to help do things that are traditionally carried out in the name of public health. And there's often a tension in the context of civil liberties and public health about, sort of how voluntary things can be when we're talking about the interest not of the individual, but the public health interest. And that's where we tend to shift the line about how much a voluntary and private should continue when we're trying to serve what is the greater good of the public's health. Your question made me think of a really important distinction here to make, which is there may be different answers to the question about voluntary versus required depending on the context. So you can imagine employers saying you can't come back to work unless we know your immunity status, or you can't come back to school was your example, which I think, in some sense is very relevant for Effy and I, because we both work at universities. And you can't socially distance if you're a student in a dormitory. It just isn't possible to do that. So we can't have students back in the environment if the virus is still circulating unless we know more about them. And so you might say, yeah, we need to know your immunity status, but maybe it doesn't then say, and if you're not immune, you don't get to come back, but rather if you aren't immune, we will create certain accommodations to protect you. So it's information to help us make sure you can do the thing that you want to do or that we need you to do. And I think that's an important way to put it. Now, in the United States, we have something called the Americans with Disabilities Act, which is meant to recognize that certain people need accommodations to perform their jobs or go to school or tasks of daily life. And so one of the questions this might invoke is whether non-immunity is effectively a new form of disability that ought to be accommodated under federal law. So not just you need to share it, but you want to share it because it allows the invocation of rights that you have to be protected and allow you to do the thing that you need to do. Go to work, earn money to, pay your rent, buy food, protect your family, go to school. And so I think there are ways in which we should think about this as helping to serve the interests of the individual as well as the public's health. So that was a bit of a ramble, and I went from one end of, well, we don't worry about privacy and public health, to saying, wait a second, this may be the way to actually serve the individual's interests. And we need to think about it across that full spectrum.
Great, thank you. One theme that emerged in talking to both of you is actually the different takes that you have to this, the crisis and how we're going to actually get out. So we have, Effy, you're in Zurich, and Jeff, you're in Baltimore, and you're both really at the forefront of, this idea of public health and the forging of public policy. And I've noticed that you're both sort of working different angles in some way. Effy, you were talking about what's actually happening in Switzerland now with the development of the app and the use of it. And, Jeff, you were sort of surprised that they were that far along and so on. So this prompts a question, and I'm just wondering, where we are in terms of a global conversation about these kinds of questions. Will these things just be worked out, in national or perhaps regional basis, and then we'll sort of see what happens, and there'll be kind of a best practices emerging? Or is there any kind of global conversation about, the uses of digital technology, the idea of immunity certificates, or are these things just happening in isolation? Effy, maybe I'll go to you first.
Sure. It's interesting to see that as the pandemic, where it started, like if you're going from east towards west, the conversations followed the same path. So in fact, amongst the first countries to even come up with those apps were China and then Singapore. Now in Europe, we're next because we were the next ones in line in this trajectory of the disease. So we're the next ones to talk about it, and we had already seen what China or what Singapore did, and I think the United States was a little later in what happened. So maybe there's a chronological element here, but in fact, the country that now has just released about 2 weeks ago the digital proximity tracing app was Singapore. That's with the technology that is supposed to be more privacy preserving than others. So we've seen that here. We haven't yet seen one in Europe, but we're very close to that. As I mentioned to you earlier, Switzerland has announced that we will have one on the 11th of May. We don't know details about it, but we know that we'll have one. So yes, countries are at different stages in the epidemic and also in their response. But I think they're converging towards the fact that they're going to be using those technologies. I think every country, if you look at in any strategy, exit strategy or transition strategy, you're seeing discussions about those tools. So it means we'll have them in some form or shape. In terms of global conversation, there is discussion in Europe about common standards. It didn't go very well, that discussion, even in that context where we have different groups doing different technological solutions, but at least we have, it is in the radar of people who have to have some sort of common standard here. And interoperability of some of those, because keep in mind that we would need them not just to get out of our houses, but we'll need it in order to travel. And there we would need to move around countries, different jurisdictions, and different technological solutions. And perhaps it's of interest that the World Health Organization is having conversations on these matters. They're working towards some technical standard that countries then can use to develop their technologies. And they're also working on some governance and sort of ethical requirements guidance that again could help countries maybe align to the extent possible in how to govern the technologies that they're using. So that's as far as the consensus or convergence that I am seeing right now.
Yeah, and you know, even since we last talked about this, Joel, which was, I don't know, a few days ago, there's now a kind of much more urgent conversation in the US about digital contact tracing. And I've recruited Effy to help us with a project we're doing here. And I'm on another, you know, similar webinar very early for me on Friday morning with folks in the UK. So I think the academic discussions, well, maybe academic plus policy plus, you know, relevant expert discussions is starting to happen much more globally. That said, you know, the conversations then need to be brought back and filtered and interpreted, applied through the systems where they would need to be implemented. And you know, one of the interesting kind of political and governance questions is, you know, how different will the implementation need to be based on the different systems in which we live, right? And there's a kind of geopolitical question too about whether one system is going to prove itself stronger, better for dealing with these sorts of outbreaks, and what the implications of that might be on a kind of geopolitical level. There was a story about this morning on Morning Edition on NPR, asking exactly that question. It's a fascinating question, but of course one we won't know the answer to for a while.
Great. Thank you both. So we have a large global audience watching and listening in, and I know there are some questions. So Alex, can I turn it to you to pose questions on behalf of the audience, the ones that have been submitted through the chat function?
Yep. Thank you, Joel.
Thanks. Yep.
So we have a few questions. This one from Stephen Barney to all panelists, I think might tie everything together the best for right now. He writes, Effy raised privacy issues connected to contact tracing. Is it appropriate at the outset to assume that pre-COVID-19 expectations of privacy are different in the digital age than in the analog age? For centuries, public health officials have required individuals to disclose medical data for infectious disease control. International travelers in particular have long been required to disclose medical conditions and to submit to medical examination. Is there an argument that individual privacy has always been secondary to the preservation of public health?
Yeah, that was sort of the point I was trying to make. Much better said by the questioner than when I raised it. But yeah, that's of course the question that we need to wrestle with. And I was trying to make the distinction between, you know, changing the idea of whether contact tracing should be compulsory or voluntary. We don't talk about contact tracing as being voluntary in infectious disease contexts, but whether this information that will aid in the tracing of contacts ought to be voluntary or mandatory. You know, one thing to point out is it's really challenging to do contact tracing for respiratory infections, because it's really hard for people to remember where they have been and who they might have exposed during the time that they may have been infectious. And this particular virus seems to be infectious for many days before you are symptomatic, so it made it even harder. And so one thought is, well, how do we aid what would otherwise be a pretty impossible task to do in the traditional way that public health cares about contact tracing? And technology seems to be potentially helpful. So that's sort of the setup. Maybe I'll let Effy pick it up from there.
Just to build on that also, there's a further distinction that I think is worthwhile making. In the analog world, you have the person infected, the exposed at risk contacts, and then the public health agencies or the professionals who are looking at that. I think when this process is mediated by technology, we got a few other players there. And that is different from the analog world. We have the phones that are running certain operating systems. We have the companies who develop the apps. We have a lot of different pieces that I think could give maybe access to whatever data that is there and being collected to maybe more than those that they need to have access to. That's one difference. The second difference is except from what kind of data you're collecting, perhaps how much more. In the analog world, you got the name of the person, their telephone number and their home address, but you didn't have a lot of information of their absolute movement every single minute of their life, whether they took that path and the other path. You need to know with whom they crossed, but you get to collect a lot more. And so this is different. And I think the potential here for misuse, while we're trying to aid something that we've agreed a long time ago, it's something legitimate and important, and maybe even doesn't require the voluntariness as much, is that to get there, we introduce entry points for harm because of the technology and because of the actors. If also you look around today in the development of these technologies, in most states that I'm looking at, it's a collaboration between state actors and private actors. There's no single actor that's doing this. And the example that, for even all of us in Europe and for the United States to have these apps become possible, you needed Google and Apple to play along and to say, we're working together to develop the API that will allow you to run your system in this way. So these are different, I think, in the digital era that change a little bit the balance, let's say, compared to the analog when it comes to the question of privacy and voluntariness.
Alex, do you want to keep going down the questions?
Sure, yeah.
Thank you. Yeah.
One question here just got in from Jonathan Gage. He writes, in what ways are the ethical questions different from those related to the widespread use of contact tracing practices by consumer-facing tech companies, for example, Facebook or Google? I'm referring here to the harvesting personal contacts in addition to web browsing habits, etc., to promote the expansion of these tech companies' social platforms. And how are the ethical issues different from the digital contact tracing already and increasingly used by law enforcement and anti-terrorism authorities in many countries? Then second, related question, what can we learn from those two existing sets of contact tracing practicing to understand the opportunities and dangers? Sorry if I did the last question wrong, but I think you get the point. Thank you.
Effy should start with this one.
Thank you, Jeff. Throw the easy one at me. Okay.
Well, you think about these things a lot, I know.
Right. So again, that's a great question, because in the digital space, we do have that happening from those big companies. And the fact that it's happening, though, it doesn't mean that we are not struggling with this, and it doesn't mean that we're not trying to develop regulation and practices that maybe contain that to some extent. In Europe, at least, we've been trying with the General Data Protection Regulation to change the habits of some of these companies as to what they can do, the way they can trace us. So I would hate to see that is, or a lot of people would hate to see that is the standard we have created, what has happened to us already in this kind of commercial context, spilling over to what happens in public health. And I think that perhaps the other layer that comes in here, the power that public health authorities and the power that the state has over us in cases like this is very different from the power that the companies have. Whether they're selling us the right kind of perfume or the right kind of detergent, or they sent this us because they traced our contacts and what we do, I think it's different from being ordered to be quarantined or isolated for 14 days and have being unable to go to work, or being fined because we didn't comply. So there's a difference in what at the end is the outcome of this. But in relation to what we learned from what happened is, I think what we learned is being relaxed about privacy and how companies can use our data it wasn't exactly a brilliant idea. And we're trying in the aftermath to do something about it. So scandals we've seen with Cambridge Analytica and other things, okay, they're not related to health, but they have been very harmful to important institutions of our society. And so the lesson is that we should have been much more careful with privacy than maybe we were, or maybe we're too naive or immature in the early days. And so those lessons are important to learn. And perhaps the other lesson from, because you mentioned in the question, law enforcement, anti-terrorism authorities, etc., in many countries, the other lesson we learned is a lot of things that happen in cases of emergencies, they seem to stick with us. And so that's one more important reason to make sure that what happens during the emergency, which is where we are now, it's carefully thought through, because the likelihood that it will stick with us for a long time is pretty high. And that's what we learned, unfortunately, from our history. So Jeff, now you're going to answer the question.
Oh, sure. Maybe I'll just make another observation to just build on what you said. I think the conversation is making us realize, which some of us did anyway, that we're carrying around devices that know where we are and who we interact with. When you open Google Maps or the map app on your phone, it knows where you are, obviously, and it collects that information. And that's something that we agree to as a part of the terms of service of using that device in that way. And I think, to the extent we think about it, we feel like, well, that's not going to be used against me in any worrisome way, at least that we can imagine. It's being monetized, but that somehow seems less problematic from an ethics perspective than it being used to track us and decide whether we can go out of our homes or not, right? Because we might be infectious. So just to reiterate what Effy's saying, it's maybe not new in terms of the fact that we're being tracked all the time, but rather the use of the information and by whom that's different in this case.
Great. Alex?
Yeah, I'll go with one question, one comment, kind of interrelated. We're getting a little low on time. So
Sure.
This is from David Tokstoy. To all panelists, isn't the tracing an effort to close the gap of insufficiency of the test, therefore a threat to privacy because of insufficiency and a lack of precaution by the authorities? And somewhat related is from C.H. Barth. Sorry if I'm pronouncing that wrong. The survival of the human species and of human societies are at stake. This cannot be left to the WHO alone. Global leadership and therefore the UN Secretary General's involvement are required to bring in the relevant socioeconomic, legal, and ethical components.
I'm not sure about that, the first question. I mean, clearly, this is all part of there's a lot of things that need to be beefed up and done better and more efficiently. Testing, of course, is part of that. But if we know who's infected through testing, then we know who to check on whether they have also been infected but don't know it. That's the point of contact tracing. So they need to be done together, I think. So I'm not sure that there's, sort of more testing would lead to less need for contact tracing, at least the way I'm reading the question or hearing the question. I don't know, Effy, if you have a different thought about that.
I'm wondering if the question is, if we were in the first place prepared to test sufficiently, and contact trace as it's required in these cases, but at a time when this was a more manageable exercise than it is now, because the disease has been spread to the extent that it has. Are we now covering up, or not covering up in terms of hiding, but trying to catch up? Because we didn't have that testing in the early days, or we didn't have the preparedness of the early days. And am I not reading the question the right way? Maybe I'm projecting what I'm thinking, because I do think that we were not, in most countries, prepared enough to respond early. And we've seen countries, even after seeing what happened elsewhere, we're still, being quite relaxed about how we're going to respond. And so, to some extent, I think it's true that we really have to, we had then to take extreme measures, and we have now to come up with additional solutions to perhaps do the catch-up game, because we were late, we were not prepared, and we're left with fewer options at this point.
Yeah, maybe in thinking about it a little more, it is the case that contact tracing is most effective early in an outbreak, right? And clearly we are not early in the outbreak any longer. And so maybe that is the point. Earlier testing and the ability to contact trace would have made a big difference. And we're now behind the curve rather than ahead of it.
And therefore now we need to have to scale it in the way that you need to maybe know with whom you're sitting in the train, and not just, you know, through the contact process.
Yeah.
That's great. We're getting low on time. We're coming to the end of the hour. I just thought we could wrap it up with maybe I could just turn to each of you, Effy and Jeff. You know, Effy, you did a great job of telling us, you know, some of your worries and some of your concerns, which I really appreciate. These are the things that we need to work on, and we need to work on together to come up with good answers and good solutions. But I was wondering if each of you could kind of give us your sense of promising development. You know, where the topic was, you know, how the lockdowns will end, and they will, and we'll find our way through. But as we're sitting here in mid-April in 2020, and things look pretty gray, it's sort of hard to tell where this is going. When you think on the plus side, on the positive side, what can you leave us with?
Well, you know, and I'm paying more attention, you know, close to home, as I think many of us are.
Yeah.
But I think it's generalizable to say that the social distancing efforts have had an effect, a positive effect, and the rate of cases is slowing down and plateauing and maybe even decreasing in many places. That's of course a very good news story. And among the things I've been spending a lot of my time on is preparing for, you know, the terrible decisions that might have to be made around triage. We haven't faced that, you know, most places. Italy and maybe Spain, notwithstanding, of course, being really, really horrible examples of where that has apparently had to happen. And so, you know, that's a good news story, but it's a good news story that shouldn't make us complacent about what this pandemic is like. And it will come back. It will come roaring back if we aren't really careful. So it's a little bit of a, you know, double-edged answer. It's not all good news, but I think there's good news if we figure out how to manage what we're doing while we somehow allow things to start to reopen in really careful ways. And the timing for that, of course, is under a lot of pressure, but it needs to be done extremely carefully, or we're just going to see renewed infections, and that won't be good for anybody.
Along similar lines, I'm looking at Europe, and most countries in Europe have actually announced a schedule of a slow reopening and return to what they call soft lockdown. So it's looking not that bad, because we're going to be, you know, moving back to some sort of transition. I see this as a second chance. As I said earlier, I think we missed the first chance of acting quickly and decisively and do the things that we had to do. I think we gave ourselves, with those painful measures, a second chance, and hopefully we won't ruin it this time again. And perhaps the other more positive thing that I would say, these have been extremely difficult measures for people to bear. And what we're seeing in many European countries, I think in the United States, was people's solidarity and people's compliance and people's also sense of, you know, kindness and empathy in small communities, in bigger communities, has been a very positive thing to look at in this very dramatic moment. So a second chance and empathy, kindness, and solidarity, I think maybe it's the way out. So I'm hoping that will be it.
Okay, thank you, Effy. That's a great way to wrap this up. And I'm glad to know that there are people in positions of power who are listening to you and who are listening to Jeff. And we appreciate you sharing all these thoughts with us and with the audience today. Just to wrap up, I just want people to know that this webinar has been recorded, so you can share it with your friends. And We'll be putting this up on the Carnegie Council YouTube channel as well as the Carnegie Council website. And anybody who's listening in, you can join us next week. We're going to be meeting again next Wednesday, and our topic next Wednesday will be prospects for global coordination in an age of pandemics and emerging climate technologies. And our guest will be Cynthia Scharf, who's a senior fellow for the Carnegie Climate Governance Initiative, or as we refer to it as the council as C2G. So thank you, Effy. Thank you, Jeff. Thank you to the whole audience, and have a great week.
Thank you.
Thanks.
Bye-bye.